Hello, Assalamualaikum everyone. This topic going to talk on allergy or hypersensitivities. So picture here showing a symptom of urticaria. This is a normal response to many allergens, such as people that are allergic to certain types of chemicals, normal chemicals in soap. Or you can also observe in many people when they are bitten with mosquitoes or bugs, certain bugs, they can develop this kind of pattern on their skin. So hypersensitivity can be described as harmful, not antigen, but harmful immune response. So a definition of hypersensitivity, it is an inappropriate immune response to an antigen. So the word inappropriate can be changed into abnormal or unnecessary response. So this type of antigen we call as allergen. Allergen are substances that are supposed to be harmless to the host or to people, to human, but somehow many people develop certain type of response to it. So this type of allergen is an antigen that causes an allergic reaction. Allergic reaction is the type of inappropriate immune response. A hypersensitivity reaction actually is a normal immune response, normal in the sense of started with the first line of defense, the second line of defense, antigen presenting cells recognize the antigen and then presented it to the third line of defense, to the cell mediated immunity and also humoral immunity, and they will develop a memory to that allergen. So a hypersensitivity reaction is antigen or allergen, in this case of hypersensitivity, specific. So they are specific. So that's why some people they are allergic to dust, some people allergic to cats, peanuts. So because they are specific. Reactions require a pre-sensitized immune state of the host. So that means they need to be presented to the T cells and B cells. Immune response that directed to harmless substances. So these harmless substances or allergen can be anything, any substance that we can contact to in the daily life. So any type of soaps, cosmetics, dust, paint, or any substance in your food. So and the location in the body where the type of response not supposed to happen, such as in the blood, in the joints. So there are exaggerated response. So we can conclude that immune response, hypersensitivity is a type of immune response that attack unnecessary substances, not pathogen, just a harmless substance, and happen in the location where not supposed to happen, and they are exaggerated, the response. So there are four types of hypersensitivity. Type 1 is mediated by IgE. Type 2, antibody mediated. Type 3, antigen antibody complex mediated. And type 4, T cell mediated. So we have a look first on the type 1, which is the type of reaction that we always observe in our daily life every day. Even as for me, I am suffering from type 1 reaction to dust. So every morning when I wake up, I would sneeze a lot when exposed to the dust coming from the pillow. I believe many people are having the same sort of problems or conditions. So this is also known as allergic reactions. So we can observe here in the picture, this young boy had severe anaphylactic reaction. Anaphylactic reaction is the severe or the worst levels for allergic type 1 reactions to a bee sting, causing swelling on around the eye. So this is also one of an example. Some people they can be bitten by bee, maybe they can feel a bit of pain, but they will not develop any reaction. But some people, they will having some sort of reaction, swollen or edema. The mechanism for type 1 is it is a cytotropic. That means attached to the cell, IgE, that coating mast cells. So this IgE produced by B cells after being stimulated by the antigen presenting cells in the second line of defense, and then on the third humoral immunity, third line of defense, the B cell would produce a lot of IgE, specific IgE, and then this IgE will go to the circulation and then coat the tissue mast cells. So this IgE coating mast cells then will react to the specific allergens or the harmless substances. So how type 1 damaging or producing the reaction? So the damage is done by the degranulation of mast cells. So we know that mast cells contains a lot of inflammatory mediators. If we refer to the previous notes, previous lectures, we can recall such as histamines, heparin, prostaglandins, and leukotrienes. There are few types of a bundle of inflammatory mediators, and then we already learned what those inflammatory mediators or substance from the granules can do to the tissue or our body. So this reaction usually they are very quick, fast, within minutes, and then they can resolve within an hour or so, more or less an hour, if they already stop being exposed to the allergen. But if they are being continuously exposed, non-stop exposure to the same allergen, it might proceed to the severe or the worst form of type 1, which is anaphylactic shock. So this anaphylactic shock can lead to death. That means we are having inflammation in the whole body. So you can imagine that swollen everywhere, difficulty in breathing. So this can happen if prolonged exposure or heavy exposure to the allergens, and because of the allergen might get into the blood, and this is one of the very reason in producing anaphylactic shock from the allergen. For example, allergic rhinitis. So this is the one that being suffered by many people, around 20% of the world population. Asthma, eczema, so these three are the same thing, almost similar. Asthma is the severe level for allergic rhinitis. So usually people that suffering from allergy type 1 hypersensitivity, they will somehow will suffer from asthma too, or eczema, the swollen or rashes on the skin. So this around 20% of the people suffer from this, and food allergy around 3 to 5%, and insect venom such as bee sting around 1%. So we have a look on the progress of allergic reaction. So first, just like the normal response to antigen, so the host APC, antigen presenting cell, will bring the allergen. This is the harmless antigen, the allergen, to the cell-mediated immunity and humoral immunity. So once they produce the secondary response, the B cells, the humoral immunity, the plasma cells will produce allergen-specific IgE. So this, yes, people, we do learn that plasma cells, majority of the antibodies produced are IgM and IgG, but they in allergic people, in people suffering from hypersensitivity type 1, their B cells also produce IgE. So this antibody IgE, allergen specific IgE, will be released to the blood, and then they will stick to the mast cell, to the tissue mast cells. And then this allergen specific IgE is like a sensor for the allergen. So once the mast cells exposed to the allergen, to the same allergen before, so they will activate the antibodies, and then the IgE will activate the mast cells to release its granules content. For example, such as majority will be histamine, heparin, prostaglandin, and etc. So those are very potent inflammatory mediators. So these are the reason. This is what happening every time, or especially every morning, for people, for example, suffering from allergic to dust. So when the dust enter their airway, the nose to the lung, so the dust will somehow react with the mast cells, and the mast cell will release their contents. And now we go to the second type of hypersensitivity. It is a cytotoxic hypersensitivity. Example here, a picture here. This is a picture of a fetus. A mother may form antibodies to her own fetus blood. So we are talking about a pregnant mother producing antibodies against its own baby that she is carrying. So we can expect a bad consequences to the fetus. This can lead to immune reactions in subsequent pregnancies. So this sentence can be explained. For example, in cases of Rh negative, so we have blood groups. Blood groups can be divided into two major types, which is ABO and also rhesus or Rh. So some people they are Rh negative, but somehow when they get pregnant, the Rh negative mother might carry a Rh positive fetus. That means the Rh positive genetic coming from the daddy, the father. So the first contact, the mother will be sensitized. That means the mother body immune system will recognize the Rh positive antigen on the fetus as foreign. So she will develop, her immune system will develop antibodies against the Rh. So for the second time, if the second time for second baby still having a Rh positive fetus, we already know that the mother already developed antibodies against Rh. So the already existing antibodies will attack the second baby that she's carrying, because the second baby is Rh positive, mean the baby got Rh antigen, the mother got Rh antibodies. So the mother will attack the immune system of the mother, antibody will attack the fetus. So type 2 is a cytotoxic reaction. Antibody binds onto antigen on the cell membrane. So this is the difference between, because type 2 and type 3 is almost similar, but the main difference between them is type 2, in type 2, the antibody react or binds onto antigen on the cell surface or membrane, because type 3 we are talking about free antigen in the circulation or in the blood. So the mechanisms, antibody coating cells binds directly to an antigen of the cell membrane to activate complement. So this is the culprit, or we can say the mechanism, because we cannot really say it's a culprit or bad guy, because actually complement immune response actually is a good response in protecting our body in the second line of defense against pathogens. But somehow now the body is reacting on harmless antigen, but still once the immune response is activated, automatically the complement, after being activated by the antibody antigen complex, they will start their own function regardless of the antigen earlier is harmless or not. The activated weapon, the complement, would still do their job efficiently. So the damage is by activities by the complement. So we can observe where antibody binds to cell antigen activates cytotoxic mechanism in the complement. Complement component activation includes formation of membrane attack complex, which is it will poke a hole on the cells. Opsonization, which is the complement help in opsonization, which will activate and call many immune cells to come and take part in the immune response, and also including neutrophils and macrophages. So that will eventually destroy the cells, the coated cells. So this can happen within minutes to hours. Example, you can observe this phenomena. For example, in part of bacteria, example M protein of Streptococcus pyogenes. So this is actually a normal, producing normal infection, skin infection, throat infection. So but somehow the antibody being produced to them, to the M protein of the strep pyogenes, they cross react. So the the same antibody being produced by our immune system is somehow they do react to destroy the microbes, but they also react the same way to the heart tissue, destroying the host heart tissue. So we call this as a rheumatic heart disease. It is some sort of autoantibodies. That means the antibody being produced is destroying the host's own tissue, heart tissue especially. This is a serious condition. Second, we already talked on research RH antigen that we can observe, we can found in the blood as a blood group, RH negative, RH positive. RH negative person responds to RH positive blood from the fetus. Second pregnancy of RH positive fetus in RH negative mom. So we call it second pregnancy because the first pregnancy of RH positive fetus, the reaction is not that bad because the mother still doesn't produce, do not earlier have the antibodies against the RH, but being stimulated by the first pregnancy. So the baby might survive because the response takes time to become optimum, but somehow it is a bad news for the second pregnancy if the same RH positive, because the mother already, the RH negative mother already produced RH antibody against RH antigen in the fetus. So these cases usually prove fatal. The baby would not survive unless they are detected earlier and go through certain type of treatment. So now we have a look on the type 3. Type 3 is mediated by immune complex, the antibody-antigen complex. So a picture of drugs here. A number of drugs are known to cause allergic responses. For example, penicillin, a type of antibiotic in the body, can bind to the protein albumin in the blood and then provoke a significant immune reaction from the body. That means the people that suffer from type 3 hypersensitivity, once they consume the antibiotics, the substance from the antibiotic penicillin, which is actually are not supposed to induce any immune response, but somehow they bind to protein in the blood and this somehow stimulate that person immune response to produce antibodies against the penicillin. So in the previous lecture we already talked about hepton. So this condition is this exact similar things that happen in hepton. So we can recognize penicillin without albumin as the carrier molecule as hepton. So the hepton, penicillin, bind to the carrier molecule albumin, and then it can induce immune response. So the problems come from the deposits of antigen-antibody complex. The mechanism, antibody binds to soluble free antigen. Once antibody bind to the soluble free antigen, they will form an insoluble antigen-antibody complex. So at first it is soluble, but once it is being trapped by the antibodies, antigen-antibody complex, they are not soluble anymore, they become insoluble antigen-antibody complex. And then this complex will traps or deposits within tissue cavities all over the body. This antigen antibody complex will activate the complement components. So these complement components, as their normal function, again the complement will respond by producing membrane attack complex (MAC), opsonization, and they act as inflammatory mediators to so many functions in the inflammatory response. Damage by antigen antibody complex that stimulate the complement components. This can happen within 2 to 8 hours. For example, serum sickness in host where host antibody, the patient or person that receiving the serum reacts to antigen in anti-serum. So we can observe this condition or type 3 hypersensitivity in the cases of when the patient being bitten by snake. So the doctor would inject anti-venom. Anti-venom is a type of anti-serum, but the patient somehow the antibody react against there are so many antigens in the serum, so somehow the host already produce certain type of antibody specific to certain antigen exists in the serum. Second, in farmer's lung or hypersensitivity pneumonitis. This is caused by farmers heavily prolonged exposure. They breathe in dust from hay, animal feed, grain, pesticides, or pollens from plants, spore from mushrooms if they involved in mushroom farming. So somehow this can affect the farmer's lung by prolonged exposure. Heavy exposure would stimulate type 3 reactions. And third, post-streptococcal glomerulonephritis. So this is a type of kidney disease that develop after group A strep infection. So group A strep is usually this type of infections is a normal infections that affect the skin as throat, as a sore throat, but somehow the reaction between the antigens from the streptococcal microbes and the antibodies producing a lot of antigen antibody complex deposits. So these deposits is insoluble and they can stuck in the kidney, because kidney as a main organ in filtering the blood. So this is a large molecule. They will become trapped in the kidney, and there the complex, the deposit of antigen antibody complex also will stimulate complement components, and all the damage would happen there in the kidney because of the trapped deposits of immune complex stimulate complement in the kidney, so it will attack the surrounding tissues on the kidney. And then last, type 4 or delayed hypersensitivity. Picture here showing a sore caused by allergic response to sticking plaster on the skin. Actually, they're supposed to be helping the patient. There's a small wound. The person stick a plaster on that part of skin, but somehow the body immune response reacting to the plaster. So such reaction are caused by the release of chemicals called lymphokines. Lymphokines is cytokines that produced by T cell. So if a cytokine is being produced by T cell, we call that as lymphokines. So T cells, type 4, mediated by T cells. The mechanism, after antigen presenting cell presenting antigens to the T cells, if we return to the previous picture here, the antigen presenting cell is actually presenting antigen from plaster. So they are supposed to be harmless, but somehow this person suffering from that. So the immune response, the antigen presenting cell bring a portion of the plaster as they recognize that as antigen, and that will be presented to T cells, which will initiate a normal response from T cells, normal cell mediated and humoral immunity. So in the end will lead to inflammation and tissue damage. The damage take days before starting to show effects, because as a normal specific immune response, we know that T cell needs some time to proliferate and become fully activated. So that's why they are being delayed a bit because of the specific immune response. The damage come from excessive amount of cytokines, unnecessary cytokines that are being produced by T cells in responding to harmless substance. So the onset around 1 to 3 days. Example, in poison ivy, some poison from plant that are exposed to the skin, cosmetics and jewelries. BCG vaccination, this is very I think every Malaysian would know this. Once we are injected by BCG somewhere when in the secondary school, so it will develop swelling. It's not that bad, but there will be some swelling on the area, injected area, with some formation of pus going on. So those reactions are type 4 reaction on the BCG vaccination, and also type 1 diabetes. So it's the required reading for this lecture. Okay, thank you. Assalamualaikum.